Hello everyone, it's Dr. David. How are you on this Monday? It's starting to feel like spring already, so that's always a positive. But I wanted to get on here because I've been getting a lot of questions about the things that I do in addition to teaching clinical students, as well as the YouTube channel, the Facebook page, the groups, and so forth. And one of the things that really is great in this field is that you can do so many things. There's an endless amount of opportunity for you. You need to love this field, but in addition to that, with love in it comes rewards. So like today, today I have my regular scrubs. I just got here. I have I got here at about 15-20 minutes early, because I really need to kind of like get in that mindset. So when I'm driving into the hospital, when I'm working at the bedside, when it's not with students, I have to kind of just focus and refocus, because I'm already focused, but refocus my thoughts and say, okay, today I'm not going to be teaching students because it's a different mindset. I'm going to be taking care of patients. So it's endless. As a registered nurse, as a physician, as a nurse practitioner, healthcare provider in general, you can do so many things to make extra money. I always tell my students, never, ever, ever let go of the bedside. I believe truly that if I am an educator, okay, I'm not a tutor, I'm an educator. There's a big difference. How can I teach my students if I'm not in the trenches? Okay, it's something to be book smart, right? And to be able to teach things from a book. But when you come in with experience and you're dealing with patients every day and you're taking care of them, and you know what evidence-based practice is, because it's not only that you're reading it, but you're actually doing it and enforcing it, is two different things. So I always tell my students, if you want to specialize later on, like if you want to do maternity and mental health and all those specialties, that's fine. But make sure that you get the experience first, because it will be horrible if you're like in a maternity unit and then all of a sudden the mom that you're taking care of goes into a code and you are standing there like, oh my God, what am I supposed to do? Because you've never dealt with it. Okay, you don't want to be that person. Or if you're in a psych unit and the same thing happens where a patient goes into a code or a rapid response and you don't know how to handle it. Or if you get a patient, which you do, in a let's say in the OR setting, and they came in with a trach, and thank God the anesthesiologist is there, because you haven't had the experience with trach care or how to take a plug out, okay, because it's so dry of suctioning. So it's very important that when you are in nursing school, you realize that you need to be able to gain those experiences. And it's nice that you want to be in these specialty fields, but maybe leave that for later. I always tell my students the following, and listen closely. Go into one of those travel websites where you can travel all over, like let's say Nightingale Nurses, and you can travel to California, anywhere, right? And I want you to pretend that you already have your license. And I want you to do two scenarios. And listen, do it please. And you're going to see what I'm talking about. I want you to fill a application out, like if you're going to work in the specialty that you're interested in. And this is for those that are not interested in telemetry, med surg. They want to go straight to maternity, or they want to go straight to mental health, or straight to the operating room. So I want you to fill out that application, and I want you to see how many boxes you can fill in. Okay? And let me know in the comments below how many opportunities opened. Now, the second scenario I want you to do is pretend that you've been in med surg telemetry, let's say a year or two. Okay? And then you decided to go into a specialty field like mental health, or the OR, or pediatrics, labor and delivery, right? Now go back to that same application and see how many boxes you can check off. There's a big difference. The difference is that now your specialty becomes another asset. Okay, that is the difference. When you don't have the med surg telemetry experience, Okay, the only experience you have is a specialty field, and there's not going to be so many jobs available for it. So you're going to do those two scenarios, and I want you to do it, because I'm telling you, this is why we tell students all the time, make sure you gain those couple years of experience, because those are crucial in order to develop all those skills and that knowledge that you've learned in school. So if you do a scenario where you went into a specialty, and then do another application where you the second scenario where you started in med-surg telemetry and then also did the specialty, now you have two things as opposed to one that's so specific. Okay, so that is why I tell students all the time, please, 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 please. I understand that you don't want to be in med-surg and all that, and you want to go straight to maternity or labor and delivery and this and the other thing, but it is so important to get those couple years into the trenches like that, because you don't want to be in the position where your patient is decompensating and you do not know how to act. Okay, the ER, it is a specialty, but you know what? There you see a lot of stuff. So I'm not going to count that. I'm going to count that as experience, because I went to the ER one time and I thought I was going to lose my license. That is not the place for me. Okay. But I've done med-surg, telemetry, I've done dialysis, I've been all over, but where I started was in the telemetry unit, and I did that for a few years. And guess what? When I experimented with other places, like when I was in transplant as a coordinator, I never left the bedside. Okay, so one other thing that I'm going to tell you is, when you do get that experience in there, and then you want to go to something like different, like let's say me, transplant coordinator, or work in a school, or et cetera, et cetera, et cetera, never leave the bedside, because that's your side hustle, guys. That is your side hustle. Because sometimes when you are working in the hospital, what happens? You get called off because there's low census, or whatever the reason is. Maybe they staff too many people, or let's say I teach, right? I teach students all the time. Well, they have vacation time. They have spring break. I'm not teaching every single day of every single minute of my year. So when I'm not teaching, I can't just sit home. I mean, it's nice. I do actually take a couple days to myself, but I have bills. I like to buy things. I like to travel. I like to do things. So, everybody likes nice things. So guess what? When I'm not teaching clinical, I have my side hustle that I come to the hospital. Like, look, today I'm off. Okay. I'm off tomorrow and Wednesday. So what did I do? I picked up time at the hospital. Look at the hospital back there. Let me see if you could see it. It's over there somewhere. The sun doesn't let you see it. And I'm here. The point is that your opportunities are endless, and you have to take advantage of them. Okay. I'm going to be doing another video where, I explain all the little side hustles that you can have in, oh my God, I got like air in my throat, that you can have in this field. There's so many of them that it's just endless. But again, number one priority, you know what that is? That priority? To love it. You cannot do this for money, even though the money is there. You need to love it, because patients will know if you're doing it because you care about them, or because you just care about a paycheck. Do not do it for the paycheck, guys. Okay? That will happen. In the beginning, I mean, you're going to be making good money anyway, but it does go up. And with your education, it goes up. I mean, my rate way bumped up as soon as I got that doctorate in January. And it was already high, but it bumped up. So know that the money's there to be made, and it's all what you make of it. But also know that you need to love it, because your patients know when you don't, and you do it for the money. Okay, so that's a little word of advice I have for you. Again, if you want, put some comments underneath. I want to see the people that did the exercise I said. I'm telling you, go to one of those travel agencies online, fill out the application with a specialty, and then fill out another one when you've already had the med-surg in there plus your specialty, and you will see how many more opportunities open up, where you can go to Hawaii, Puerto Rico, Miami. I had a friend, I'm not going to say her name, but if she sees this video, I'm sure she will. She knows what I'm talking about. She lived in Miami for 2 years. I mean, I can't do that because I do have a family and responsibilities here and where I live. So, but trust and believe that if I was able to do it, I would. You go to Arizona, California, San Francisco, Seattle. I mean, everywhere. I have another friend that went to Seattle, but she had not only did she work in step down with me, but she also then went to ICU. So she already had the med surg. So she got a bunch of opportunities. And whenever you travel, okay, those places will renew your contract every 13 weeks. They pay you for your boarding, and they give you this and the other thing. But remember, it comes with experience. So the more opportunities you will get is because you have more experience under your belt. Well, with that, I say goodbye, because I'm now 10 minutes, actually like 5 minutes from my start time, and I'm here in the car. So I wish you a great rest of your day, and look out for that next video. Remember, subscribe, like, and share. Thank you so much for the support. This channel is growing quickly, and I strongly thank you for that. All right, have a great rest of your day. Bye.